A healthy little boy walked into a dental clinic with nothing more than bleeding gums. Few weeks later, he was on life support in our ICU. One scan revealed a devastating brain bleed, and his parents couldn't believe that they were hearing. This is a true medical story that every parent needs to hear, because smallest symptoms can sometimes hide the biggest danger. There are some patients you never forget, not because you spent weeks treating them, not because they recovered against all odds, but they remind you know how quickly life can change. As a healthcare professionals, we see joy, relief, heartbreak, and grief almost every day. Most of us learn to stay calm in difficult situations, but every so often, a case leaves a mark that stays with you forever. Today, I want to share one of those stories. It is the story of a young boy who was 13-year-old whose life changed within weeks. It is almost a reminder that symptoms which seem small at first can sometimes be the first warning sign of something far more serious. It was another busy shift in intensive care unit. Monitors were beeping, ventilators were running, and doctors and nurses were moving quickly from one patient to another. Suddenly, we were informed that a critically ill child was on the way. Within the moments the ICU door opened, the team rushed a young boy into the unit. He was completely unconscious. He wasn't responding to voices. He wasn't responding to pain. His Glasgow Coma Scale score was only 5 out of 15, indicating severe impairment of consciousness. Everyone immediately understood the seriousness of the situation. There was no time to waste. The airway had to be protected. After careful assessment, the decision was made to perform endotracheal tube intubation so that a ventilator could breathe for him. The procedure went smoothly, but the atmosphere remained tense. The question everyone was asking was simple. How had this happened? Speaking with his father, once the child was stabilized, we spoke to his father. He looked exhausted. His face reflected fear, confusion, and disbelief. We gently asked him to tell us everything from the beginning. At first, he struggled to speak. Then slowly, he started explaining what had happened over the previous few weeks. According to him, everything had started with what seemed like a dental problem. The boy had developed pain in his gums. His gums were swollen. They also bled occasionally. Like many parents would, they assumed it was related to his teeth. So, they took him to a dentist. Medications were prescribed. The family hoped things would improve, but they didn't. Looking for answers, a few days later, pain continued. The bleeding continued. So, they visited another dentist. This dentist took a more cautious approach. He explained that before carrying out any dental procedure, he wanted a complete blood count, often called as CBC or CPC test, to make sure everything was safe. The family agreed. At that moment, none of them expected that one simple test would completely change their lives. When the blood test results came back, something was very wrong. The boy's platelet count was extremely low. Platelets are tiny blood cells that help stop bleeding. Platelets levels become dangerously low. Even minor bleeding can become serious. The dentist immediately advised the family not to proceed with any dental treatment. Instead, he recommended urgent medical assessment. The family went to hospital, doctors ordered further investigations, more blood tests were performed, specialists became involved. Then came the diagnosis no parent ever wants to hear. The child had blood cancer. For the family, it felt impossible. Just weeks earlier, he had been playing, laughing, and living a normal childhood. They were hearing words that completely changed their future. Unfortunately, events moved incredibly quickly. Within only a day or two after the diagnosis, the boy became unusually sleepy. He was difficult to wake. His responses became slower. His level of consciousness continued to fall. His condition deteriorated so rapidly that he required emergency transfer for intensive care. That was the moment he arrived in our ICU. Although the child was now receiving full intensive care support, we still needed to understand exactly what had happened inside his brain. An urgent CT scan of the head was arranged. The entire team waited anxiously. When the scan appeared on the screen, the room fell silent. The child had suffered a massive bleed inside his brain. His severely reduced platelet count had greatly increased the risk of serious bleeding. The scan explained why he was unconscious. It explained why he could no longer respond, but it also showed just how devastating the situation had become. Over the following days, every member of ICU team continued to provide highest level of care possible. His blood pressure was spotted. His breathing was maintained by ventilator. His neurological condition was closely monitored. Every test was performed carefully. Every decision followed established medical standards. Despite all efforts, there were no signs of recovery. Repeated neurological examinations remained unchanged. The outlook became increasingly difficult. Eventually, after thorough assessment and following accepted medical protocols, it became clear that the brains had suffered irreversible injury. The medical team carefully completed all required evaluations. The findings were consistent with brain death. They are conversations no doctor ever wants to have. This is one of them. We invited the parents into a quiet room. We explained every test. We answered every question. We spoke slowly. We gave them time. His father listened silently. His eyes filled with tears. His mother could hardly believe what she was hearing. She kept repeating the same question. How can this happen? He was fine. He was playing only a few weeks ago. How can my child suddenly have blood cancer? No parent is ever prepared for news like that. What made the situation more heartbreaking was that the family had only two sons. The older brother was waiting outside, confused and frightened. The younger brother lay in ICU surrounded by machines. The mother remained in complete disbelief. She couldn't accept that her little boy would never wake up again. She held his hand. She spoke to him softly. She hoped that he would squeeze her fingers. She hoped he would open his eyes. She hoped the doctors had made a mistake. But sadly, hope and realities are not always the same. Watching parents experience that level of grief is something healthcare professionals never truly become used to. This story is not about blaming anyone. The parents acted when they noticed a problem. The dentist referred the child for further assessment when the blood results were abnormal. The medical teams worked hard to diagnose and treat him. Sometimes illness progressed despite everyone's best effort, But the story reminds us of something important. Persistent symptoms deserve medical attention. Bleeding gums are often caused by common dental problems, but in some cases, they can be a sign associated with other medical conditions. Easy bruising, unexplained bleeding, persistent tiredness, repeated infections, or prolonged fever should never be ignored. Most of the time, these symptoms will have causes that are not life-threatening. However, occasionally, they may be the first warning signs of a serious illness. Early assessment gives doctors the best opportunity to identify the cause and begin appropriate treatment. As a healthcare workers, we remember many patients. Some recover and leave the hospital smiling. Others teaches us lessons we carry for the rest of our careers. This young boy became one of those unforgettable patients. His father reminds us that life can change far more quickly than we ever imagined. If you notice persistent or unusual symptoms in your health or someone you love, seek medical advice promptly rather than hoping they will simply disappear. Early evaluation may not always change the outcome, but it can make a crucial difference in many situations. Thank you for listening to this story. If sharing this experience encourages even one family to seek medical care earlier when something doesn't feel right, then this child's story will continue to help others. Take care of yourself, take care of your loved ones, and never ignore symptoms that continue, worsen, or concern you. Because sometimes acting early can save a life.